practicing surgery for almost 2 decades now. Like, have there been any really challenging cases you've come across?
Yeah, definitely. When you take as a surgical experience overall, there are so many. But to name a few, especially in spine surgery, I always one case is very near
Memorable?
and near.
Like, is this case really memorable to you?
Yeah, because the case was quite challenging and the situation was such that a lot of stress for the doctor and for the patient families also. What happened was she is a female patient, very young female patient. She was 7 months pregnant.
Oh,
So this lady, this was a precious pregnancy because she had multiple abortions in the past, and uh, astonishingly, the whole family didn't had any kids. So this was the first pregnancy
so
she
like
had.
first kid in both families.
Both families, so multiple abortions in the past. It was a very precious pregnancy.
Very emotional pregnancy.
Very emotional. 7 months she was about to complete. Suddenly one day she felt some pain in the back, and her lower limbs got paralyzed, and her bladder bowel control went away, and they just came all the way from Maharashtra. Someone told my name, so they just came in the ambulance. And I examined her. Her limbs were almost 80% weak. Her bladder, someone catheterized outside. Then motion was, the control was not there. So she was in lot of agony because she had 7 months pregnant. She doesn't want to lose pregnancy. At the same time, obviously your legs are not working, and even you can't get up and sit and go to washroom. So there were a lot of confusion going on, a lot of social issues and emotional trauma to the patient. So that was a tough time. So then we have to sit with the lady's family, the husband's family, talk to both families what is important. Obviously, the patient's life is important. At the same time, because the baby is a very precious baby, that is also important. So very tough. We discussed for 2 hours, but we didn't have time. The more you delay, the more
complications were starting to arise.
And lesser the chance of recovery.
Okay.
Because they had come in less than 24 hours. So when we operate such instances as early at the earliest, the recovery is fast. Though for me it was tough to decide to save a patient or to save the baby. So then we sat and discussed. So I gave them an option. Hey, look, my gynecology, the obstetrician friend also was sitting with me. We talked to them, said, see, we try our best. What we do is we deliver the baby and keep the baby in NICU. Then we'll see if baby stabilizes and baby is stable, then we can just save the baby. Then I will operate on you the same time on the spine also, and we try our
to save both.
Save both. So then they agreed because both were dear and near to them. So they agreed. Then what we did was we delivered the baby in the gynec theatre. Once the baby was delivered, immediately the baby was shifted to the neonatal ICU. Then we shifted the patient anesthetized to the neurosurgery theatre. Then we made her prone. But here problem is cesarean is there. You have to take care of the incision, should not have pressure on the abdomen. So we took care, all the precautions we took. Then I operated on the spine. There was a big tumor in the spinal cord. So luckily, with God grace and patient luck, we excised the entire tumor. I was able to remove the entire tumor, and to my surprise, I never thought she will recover so well or so fast. Within say 1.5 months, that is 6 weeks, she started walking. and within 3 months her bladder completely recovered, and of all the surprises, baby got saved. So they came to me after 1 year with a baby walking, she walking to me into the clinic, into my office. I was so happy to see. I never expected both got saved. She recovered, her entire legs got recovered, and 1 year later we repeated the MRI, and to our surprise, no tumor was residual was there. Entire tumor was gone. We thought if any residual is there, we
We'll
have to
need to
give
like,
radiotherapy or chemotherapy, but
there was no remission.
there's no recurrence, no recurrence. So complete tumor was gone. So that is one case where I feel very happy that both families came to me and said, every day we think about you and you saved both our the lady's life and the grandson life. So they're so happy. So you see that happiness, and they speak to you in gratitude. That's, we think that's enough for our lifetime, where whatever struggles we had to become a neurosurgeons, this is enough. So that happiness always stays with us for a long time. Whatever irritations in there in life, they get all nullified with this one small happiness you see on the patient face. So this is one case I always like to remember. And second case, when it come to endoscopy, this was a lady, 82-year-old lady, and her husband was 90-year-old.
Oh.
He was a doctor, and this lady is 82-year-old. Both live in, I think, Vijayawada. So
Did the kids live with them?
yeah, some kids were in US, some kids live away. So they both live only, they both were living, but they were healthy, hale and healthy. Though she had some lot of spine issues, she was able to manage. But they came to me asking that she has started having severe back pain and leg pain. She is not able to even go to washroom. This started after some festival. She did some lot of work, and suddenly she started having
Okay.
this pain. So the doctor husband, who is 90-year-old, he says, "Hey doc, just relieve her pain. I don't want anything. I don't want big surgeries. I heard about you. You do endoscopy." This I'm talking about 5 years back. So you do endoscopy. You just relieve her pain. I don't want anything big things, because she's 82-year-old. I don't want any big
Open
surgeries.
surgery would be risky.
Because she had lot of degenerative scoliosis of spine. So many surgeons suggested she needs big surgery, so better whatever life she has, let her continue like this. So, but there was a lot of pain. She was not able, as a old man, he was not able to take her to a washroom or make her sit. It was difficult for him. So then I did endoscopy for her. So the happiness was like she was able to walk from the next day, smile on her face is back. She says no pain for me. And I forgot about the case because they didn't follow up. I thought maybe she passed away, or I don't know. I just
She was already really old.
yeah. So 4.5 years later, her son calls me, says, "Doctor, thank you very much." I said, "Why?" "You operated on my mother 4.5 years back. She lived very happily for 3 years without pain. Recently, she passed away because of her heart problem. But we are very thankful to you that you gave her 3 years of her life, which was there without any pain. She was able to do her routine work without any support." So that gives us more and more, motivation to do more and more things in spine, especially endoscopic spine surgery, which as an open surgeon, which I was not able to relieve the pain or convince the patient that nothing will happen to you after surgery. But with this endoscopy, we are able to convince the patient and give the same result what patient wants with endoscopy.
So like you've managed to like negate any fear around surgery right now.
Yeah, so obviously any spine surgery, when you think, so spine surgery, people have
It's
a
like
very
serious surgery they
very
will think.
bad notion that spine surgery means you get paralysis after surgery, you can't work, you can't go back to work, you are bedridden, and so these kind of myths are there, and these myths are now no more, because with endoscopy, all these fears need not be there. So that's why more and more people are coming forward to get spine surgery done with endoscopy.